WMEL.
It's the Talk to Me Network on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard, an organization designed to inform, educate, and help connect seniors and those that take care of seniors to resources they need so they can live a decent life. You know, I just listened to that music again. I can't hardly believe that I've been listening to that music for 17 years. It's been a long time. It's a long run on this radio show, and I've enjoyed it so much over the years because we've been able to bring a lot of good information to people that need the information. And despite what you might read in the newspaper or hear on television or anything else, folks, believe me, senior citizens do need a lot of help, do need care. I'm not saying that they need to be given anything. I'm saying they need to have services available so that they can access them. Some people need a little more help than others. And something happened recently in Brevard County in the budget hearings at the county commissioners meeting where it was decided to do away with the county-based operation funding over a period of 5 years. Folks, what this does is hurts a lot of organizations, not just seniors, but children, other organizations that have been helping people for the 27 years, 28 years I've been involved with senior citizens here in Brevard County. And it's not a question, I don't think, of the commissioner doing something because out of a meanness or anything like that. That's not at all. They think they need to have better control of the budget. I agree they need to have better control of the budget, but this is not an entitlement program or anything like that. This is something that gives incentive to nonprofit organizations to build service programs that help people. And certainly if these programs didn't exist, there would be a lot more expense to a lot of people, most of whom could not afford the services. So we're on a process now to help educate the commissioners, to help them understand what it is that they give up if they do away with the services. And I have every confidence that once we explain the correct workings of the county-based operation fund to the commissioners, that they'll rescind their decision and listen to what they can do to help people do a better job of taking care of each other across the board. So that's why this radio show has existed all these years, to bring you information about what happens in the county, to bring you availability on services. And in order to do that, we have a number of services that do help us provide it, like the Eye Institute, Bill Johnson, the elder law attorney, this radio station, Brevard Chiropractic, Market Street Memory Care, and Dr. Lee Sheldon, who is the owner of Solid Bite Dental Implant. And I always like to mention that because Dr. Sheldon has a program that over the years he's contributed a lot to, and he and his partners have contributed a lot to the charities in Brevard County. This organization, this dental organization, is a group that recognizes not only seniors need help, but children need help. And I think there are 4 organizations. I'll let Dr. Furtado talk about that just for a minute, because Dr. Furtado is one of the new surgeons at Solid Bite Dental Implant. Dr. Furtado has an interesting background. I'm not going to ask him to go into the whole thing, but I'll say that, and maybe we'll talk about it a little bit today, but he started out in Brazil, ended up in Canada. He's got an interesting background, and now he's torturing people with dental instruments, and which is kind of like waterboarding.
Yeah, with pleasure.
I'm only joking, right, Doctor?
Yes. It's been an interesting life. It's been fun. Graduated in Brazil in 2003 and been to the research world in 2005 up until 2010. And then went to being a surgeon in the U.S. I've been in Connecticut and Texas, and now Florida. All thanks to my wife. We're talking about how we blame our wives for things here before, so I'm going to blame my wife for this. It's her fault we are in Florida now, and we're not moving. But yeah, it's
Well,
been
it's
great.
kind of like me. When I got retired from the Navy, my wife said she didn't want to live anywhere north of I-10. So that didn't leave a whole lot. Left Florida, a little bit of Mississippi, and Texas. And I wasn't going to go to Texas.
Yeah,
I
you're
didn't want to
right.
go there.
Oh, I've been there, so I'm here now.
We're glad to have you here because I know, folks, there's a lot to talk about when you talk about periodontal care, implants. It's just like buying a low-end car and a high-end car. Do you want cloth seats that are going to roll up on you and not be very comfortable, or do you want buttoned leather seats like they used to put in the Mercedes? What do you want? And you have to make a decision. And I've always tried to understand, Dr. Furtado, why dental implants cost so much, but after talking to you and Dr. Sheldon over the years, I found that there's so much that we don't know about dental implants. But let's just talk just for a minute today, just a short discussion on periodontal disease and why early detection and treatment of the periodontal disease is so important, and it can prevent the necessity to put implants in or to remove teeth.
Yeah, that's very important. A lot of people are now, because they know that the existence, they know about the existence of implants. They all want to take their teeth out, and that's not what we prime for. We go to specialty school primarily to diagnose those cases early enough so that we can save as many teeth as we can in a predictable manner. So gum disease and caries and cavities are the two main diseases of the mouth. Most of 99.9% of the people that lose their teeth are either because of one of those diseases. The rest is because they suffered some type of trauma, car accident, or something like that. But cavities and gum disease are the leading causes of tooth loss. And you look at the research, and our specialty has a really good place in the research, in the dental research. They've been leaders of dental research for so many years now. The way we understand and we see gum disease has evolved so much from the 80s to now. In the beginning, we thought they're just because there's some bugs in your mouth, a specific class of bugs that act in a way with your gums and under your gums, and they start damaging the bone around the teeth, damaging the gum, so you lose the support for the tooth. The teeth start to get loose. They start to bleed, and then that's when you, as a patient, notice that you have gum disease. You're in the mirror, you're brushing your teeth, you're flossing, and then there's some blood, or you spit in the sink and there's some little pink there. That's when you notice, when the disease has started much before then. But now we know it's not only bacteria. There might be some other agents making the disease worse. We now know that the immune system has a big impact on the gum disease. So it's how your body fights those bacteria. And now we know there's some viruses involved in that too. So it's a much more complex disease than what we thought it was 30, 25 years ago. And to tackle that disease, like with any disease in your body, the earlier you notice, the less damage that it's done, the easier for you to save the teeth. So now we know the immune system plays a role. We know there's bacteria, there's viruses. And the main thing is, and Dr. Sheldon talks about that a lot, and we have on his book, The Ultimate Mouth Manual, we really go into length in talking about diet, because a lot of people don't realize how important the diet is. You know, talking about how your body is going to respond to an infection. Well, if your immune system is well, you're not going to have you're going to have less problem to fight an infection.
Well, I agree.
And that diet is is number one factor that can keep you away from inflammation, from your body, from hampering your body from fighting those diseases or any type of infection in your body, for that matters.
But how prevalent do you think that the disease, periodontal disease, is today in the United States compared to what it was years ago? Do we have a better control, or are we just starting to recognize that we did have a problem that we didn't know about? What would be your comment on that, Doctor?
Well, that's if you go to the American Academy of Periodontology website, it's the perio.org. Perio, Perio.org. There's been a lot of research on first diagnosing the types of gum diseases, and then identifying that in the United States. At this point, we have about 47% of the adult population with gum disease in the country, at different severities. So 30% are of the more moderate type of gum disease, and then 8.5 or 9 to 7 to each of either the very, very mild or the very severe one. So and you see there on the website all the research, all the articles. There's a space there for the patient to know what a periodontist is and what we do. But about half of the population have some type of gum disease.
The people that don't know that they have a problem of this type, would a general dentist, say a person goes in for a cleaning, okay, and most people get I think the recommendation, I think it used to be, get your teeth cleaned every quarter, but most people don't get them cleaned that often, I don't think.
No.
But would a general dentist, if somebody goes in for a tooth cleaning, would a general dentist really be able to visibly see periodontal disease in its early stages? Or the reason I'm asking this is that I'm trying to figure out how we can do a better job of getting people in for earlier treatment of a disease than we have in the past.
Yeah. Well, the general dentist is trained to diagnose the disease. Diagnosing the disease shouldn't be complicated. We look at parameters like, do your gums bleed? Are your teeth loose? So you as a patient, both of those factors, you can see that. But the dentist has a small ruler, very small ruler. It's called a probe, a periodontal probe.
Okay.
And there's a way that we measure in 6 sides of the tooth, every tooth in your mouth. When we do a periodontal exam, we go around every tooth in your mouth and we measure the distance of where the top of the gum is to close where the bone is around those teeth. We don't go up until the bone, but we get close. And there's a certain distance that we call the healthy distance, and that's about 3 millimeters. Anything above 3 millimeters, in general, means that you lost some type of support around that tooth. So that's what us as clinicians, what we can do. We look at the x-rays, we know what the normal levels of bone around teeth are, and we probe and we measure how much is it bleeding. Is there pus coming out? Are the teeth loose? And what are the measurements on the periodontal probe? So we put all those factors together, and we know if the patient has periodontal disease or not. But a simple exam will be just probing. Does it bleed? What are the numbers? At that point, the general dentist should know, and I believe all of them should know. Because I've been through dental school, and I've been through 3 dental schools, one in Brazil, one in Canada, and one in the U.S. And for the latter 2, for the Canadian one and for the American one, because it was at a postdoc level, I also taught. So I also went to the pre-doc clinics to teach the students.
Okay.
That's part of the program.
Okay.
So you tell them and you show them, you teach them with the professors, you teach them how to diagnose periodontal disease. So I'm pretty sure they do know. Now,
Well, let's just say somebody listening to the show, listening to you and me talk about periodontal disease, and I know my wife flosses. I watch her floss. She's a tiger at it.
Yeah.
I mean, she really rips at those teeth. In fact, she breaks the dental floss sometimes going after the teeth, and she's pulled caps off from flossing. Well, if I suspect I got a problem with a cap, I just pull the thing down and then pull it out the side of my mouth, and not try to go against the cap on her.
True.
But if people listen to the show, if they just in the process of flossing and they really do flossing the right way, if you get a little redness or which is indicative of blood, should you be alarmed right away, or can that be just to see a good sign of flossing?
it could be that you're flossing too hard. And the good way to test this is brush that area. Brush that area for about a couple of days, for about a week, and see if that's bleeding again, if the bleeding persists. Another way to look at it is there's some tools that are called proxa brushes. Proxa brushes, because proxa means in between. So
Okay.
those are small brushes that look like a pine tree. Very, very tiny ones that you can put in between your teeth.
Okay, I've got to. That's what those things are for.
Those are beautiful. Though, if you use those, okay, you're using the floss, you hurt yourself. Brush that area a little. So it means if you're bleeding, if any part of your body is bleeding, that means it's inflamed. So you either inflict some trauma with the floss, or you have some types of bugs there that are having a party, and you're bleeding. So don't floss there. Use the proxy brush for about a couple of days or so.
Okay, now I understand the ones that are shaped like pine tree, but how about the ones that are just like a cylinder? What are those used for?
Those are designed to fit into different gaps in between the teeth. So have an assortment of different ones, because usually the front teeth will have smaller gaps in between them. The back ones will have bigger gaps. So the pine trees will be, the cant and the pine trees will be either, the angle will be either wider or narrower, and those are designed to fit different spots. But the idea is the same. You just go in between the teeth and you clean. And it's interesting that we're talking about floss, because there's a big problem with the media. Not problem, but there was a big fuss. It was about a couple months ago. There was a study from England saying that flossing was not beneficial, that you shouldn't floss. And then there was this big, fight in between the professionals, and we shouldn't say that, because there's been some evidence that that it does help, and it's one of those things that it just makes sense for you to clean in between your teeth.
Oh, I agree.
So I don't know why that type of study or information comes out and it's interpreted the way it was. But it is important to floss, and you shouldn't be jamming the floss into the gums. You can apply some pressure to pass the contact points between the teeth. That's okay. But don't force the floss into your gums. And the idea is that once you pass the contact, you embrace the tooth, you embrace the hard part of the root of the tooth, and you go up and down, so that you remove any deposits of food that get a little sticky. It's gluey, and you just disperse that with the floss, so that when you swish, it goes out.
And that's along with the theory that we never really talk about this, but if you floss them, that's one of the reasons why you should brush your teeth or floss your teeth before you go to bed, because it gets rid of the accumulation of the day, and that helps prevent decay.
Yeah, absolutely. The most important time if you were to choose one time in the day, during the day, that you should floss and really clean your teeth, that should be before you go to bed. Mainly because during the day you're talking, you're eating, you're drinking water, you're producing saliva. And saliva has a lot of antibodies. Saliva has cleansing abilities, and your tongue is always going around and cleaning your mouth. Now, when you're sleeping, that goes to zero. You don't produce any saliva. Your tongue is quiet, and you have no innate ability to clean. So before going to bed, brush, floss, clean as best as you can, because then the load of bacteria that you have there, the load of anything harmful, is just put down, and then you can have your sleep without any damage.
Your explanation of that kind of goes along with something that we talked about before we went on the air, when I commented that I had recently broken a tooth, and I jokingly said I broke it on one of my wife's muffins, and that wasn't true. It just came apart. But you made a comment about the fact that and my wife had commented that the tooth had gotten dark, and you said, what did you say? About starting,
well, that's one common belief as well, that at the moment that you bit on that muffin, that's when your tooth broke. That's usually not the case. That tooth has been receiving trauma for, I don't know, however 20, 25 years that you had that filling there, and it just cracked. Now, it's just like when you have a little pebble hit on your windshield and you see the little cracks. It's just spreading, and that's the same idea with the tooth. The tooth is a mineral, and you just substituted that to a filling material within that mineral that has different response to hot and cold, to heat and cold, and that per se is trauma, and you're biting on that. So as you use that filling and you chew throughout your life, you've been traumatizing that tooth, and now it broke.
And now, okay. Yeah. It's interesting because there's so many things that we take for granted with our mouth, and there's so many things that we fail to talk about. But what we're going to do is we're going to talk about some specific things that Dr. Furtado and the other doctors at Solid Bite have in the way of treating, and why the types of implants they do are really important. And there's a lot that I think we need to know more about that you don't know. So stay with us. On the other side of the show, we'll be back in about 2.5 minutes. Stay with us.
WMEL.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors. I mentioned some of the sponsors for the second part of the show are Senior Scene Magazine, Hometown News newspaper, Pit Crew Roofing, one of our brand new sponsors. We got several others, and I'll have to get all their names. I'll mention them next week. Seniors Helping Seniors, Barbara McIntyre, Home Equity Loan Specialist. And it's an interesting thing that she got a phone call about a week ago. A guy in California said to her, "I'm looking at you." And Barbara said, "What do you mean you're looking at me?" He said, "I'm watching you on YouTube." And he said, "I want you to do a home equity loan mortgage for me." She says, "I'm in Melbourne, Florida, sir." He says, and she said, "You're in California." He said, "I know." But he said, "I still want you to do it because," he said, "I've never talked to somebody that seems to know as much about it as you do." So that's kind of a tribute to the work that our sponsors do. And we're sort of picky about who our sponsors are. We're not just everybody is a partner with us, but we have some great ones. A couple of others I want to mention were Canadian Meds in Melbourne, Vitas Hospice and Ear Care, and in-home personal services. There are just so many things that people need to know, and but we got a lot of things I still want to talk to Dr. Furtado about. And during the break, we were talking about something that I think it's even more important for Dr. Furtado to talk about. It's about the recognition of when you might need an implant, as opposed to putting a two, and I think sometimes, Doctor, they've gone as far as three-tooth bridge. Yep. Do they do more than a three-tooth bridge?
Not nowadays. We try to avoid that.
But explain to our listeners why you need to be careful about whether you use a bridge or an implant. I think it's important for people to understand this.
Yeah. There's different ways to restore teeth that are lost. There's removable ones, which are those that you take out of your mouth, and a bridge is a fixed one, which entails cutting the tooth or the teeth that are abutment and placing caps on those teeth with a floating tooth in between that's connected. So you have 3 teeth. Let's say you have two teeth, 2 roots as abutment, and 3 caps to close that space. There's also the implant, which is a root replacement that receives a fastening abutment and the cap, the crown on top of it. So those are the 2 fixed options. And part of the treatment planning process, and I gotta say this here, Joe, that Lee is a master in treatment planning like I've never seen before. He's now teaching other offices to treatment plan and to make things like we do in the office. And he's now known in the whole country for this. He's actually now in Atlanta talking to some periodontal residents of a program there. So he's been invited to talk in a lot of places now. And that's because he's mastered this. He's done this for so long that he knows a lot on when is best for you to put a cap, put a bridge, or put implants. So basically, we looked at predictability, and I was talking to you about the example of a patient that has caries, has decay all over their mouths, or they have a lot of caps. So we know that in their history, they have a history of high caries risk. And back in school, in specialty school, we're all about risks. And everything that you do, every decision that you do in your life, is about risks and benefits. So we look at a patient, and we say, what are the risks of this patient receiving new caps? Just so that I can go over the steps for you. If they have caps already and there's decay, there's a great chance that decay has gone deep down the root or close to the nerve. And so we don't know what we're going to find after we take the caps out. You have to cut the caps out, and whatever's remained from the teeth, that's what we're going to evaluate. So it's like you're going into the wall of your house or remodeling. You don't know what you're going to find on the plumbing or whatever's inside there. It's the same idea. So we go, let's say a patient that has a lot of caps, a lot of bridges, and they just had decay under those bridges. Then part of the treatment planning process is how much caries they have. Is that in every bridge they have? How is the acid levels of their mouths? And there's ways that we can measure how acid the mouth is. And caries and cavities will be higher in people that have acidic environment. So that if the pH is low in the mouth, those are patients that will have more decay. So caries risk. We look at what's the risk of this patient to have caries if we place the most beautiful, the best crowns and caps and bridges that we can give them. What is the risk for them to get caries again? And how many teeth we can save after we take those caps out and evaluate. So all of that is evaluated through the clinical exam that I mentioned before, the probing, the checking where the caries are. We have cameras that go in every tooth in your mouth, and they take pictures with a very bright light. They really they fit into every tooth, and they take pictures with a very bright light to show where there is cavities.
You can do that without doing anything? Is that your digital exam?
That's one of the new equipment that we have, but that's a supplement to what we do already. We're not substituting the regular way of checking caries.
Okay, all right.
So we take X-rays, the 2-dimensional X-rays. We take 3D X-rays. We take pictures because that's important for the patient to visualize that too. Sometimes they don't see it, and we can take pictures of individual teeth to see if there's caries there. So we use everything that we have to evaluate a tooth per tooth basis, how can we predictably reconstruct the bite of this patient without causing any trauma, any more trauma than the actual dental trauma of the procedure. And after evaluating the risks and benefits, we choose either to save the teeth, and there's many ways we can do that, or to place implants. But going back to the patient that has a high caries risk, their teeth are breaking down. There's cavities that go under the root, that go into the nerve in many teeth. If they have good bone, and we can see that on the 3D X-ray, if they have good gums, we will tend to go more towards the implant route, because implants cannot get decayed. You can't get decay on teeth. We can work with that diet. We can work with a lot of with their physicians to see what type of medications may be causing the pH to be low in their mouths.
Okay.
And then give them implants, which are going to be more predictable in the long run. Now, if the patients have decay, they are superficial. We see some problems on the caps that were placed before, with some margins that are opened. There's no the bonding between the caps and the teeth are not ideal. Then we know there may be other problems than the patient proneness to having decay, and if we can save those teeth, we'll save them, and we'll give them bridges in the best way that we can. They may need a little bit of gum surgery to provide more tooth structure so that you can put caps on them.
Let me ask a question now, since you raised that.
Yeah.
And the way your office is structured now is solid bite. You have you and Dr. Sheldon are surgeons, and you can do it, the implant work. And then the other Dr. Sheldon, Matthew, he's a general dentist. Does he do the type work like the bridges and things like that? He can do that.
Yeah.
So what you're saying is a person can walk into your office and say, I think I need an implant. Mm-hmm. And you can do what you're saying, and after you look at it, you see you may not need an implant. You may be able to do something else.
You'd be surprised of how many people just come to the office and say, I want all my teeth out.
All of them out?
Yeah. And we look at them and tell them, we can save your teeth, and we can give you a big smile, better smile, without having to take all your teeth out. Now, in those cases, some of the teeth may have to come out, and we'll work with them. We'll put implants, or we'll make crown and bridges. But there is a bunch of patients that will come and say, I need implants, because there's a big people know about implants. You know, if you go on the website and you try to research, patients will know, and they'll talk with their friends, and their friends will have a great experience with implants. And I agree, implants are great, but if you can't save the teeth, I would prefer saving something that's been there for 30, 40 years, and that came with you. that were given to you.
That's interesting, but I don't want to run out of time. There's a couple of things I do want you to talk about today, because you sent me an email and said there's a couple of things that you're doing now, and I think it's important. But everything you're talking about is the examination. Is you're actually looking, you're X-raying, you're taking pictures of the teeth, and you have equipment now that can really see down into the root. Yeah. Correct.
Yeah, you can see where the bone is.
How? You're doing some work over there now, and the one thing I don't understand is that you talked about the influence of digital information in dentistry, and the fact that you have the technology to plan and do everything in a computer before you even touch a patient. You said you could take digital impressions, you can take 3D X-rays, and you're able to place implants and temporary teeth in the computer, and you actually are. It's like I keep talking about building an aging plan for Brevard County. What you're doing is building a plan of how to rebuild the mouth.
Yes, absolutely.
How about describing that for the listeners? Because I think that this is something that This is the type of information you're not going to read about it.
No.
You're just not going to. You're going to have to hear it, and maybe 80% of the people listening. It won't affect them, but they might have a friend that has a problem. They know about it, so this is the way good information gets passed on. So, what is really the effect, and what are you doing over there with this digital stuff?
Well, it's a fascinating time now, Joe, to have the ability to plan everything with the end goal in mind. We call it reverse planning. So let's say we place in an implant. Well, to me, an implant's very important. I'm the surgeon, so it's the best thing in the world. For the patient, he wants a tooth. He doesn't care about an implant. Well, he cares, but he wants the tooth to chew. And when I say implant, I mean just the root replacement. The metal root that I'm going to put there to receive the cap that Dr. Matt's going to do. I usually joke with my patients that I'm the bloody guy. Dr. Matt Sheldon is the beauty guy. He makes them pretty, and so it's fascinating to be able to have a patient in the office. We take pictures. We have a video or a machine that's called the iTero, which is a camera that will go inside your mouth and take pictures of your teeth. And that's transferred to the computer. And when we look at the computer, we have the exact copy of your teeth and the topography of your gums and the shapes of your teeth. And everything is in there. More accurate than the goopy stuff that we used to have on the trays. We still use a little bit of that, not much. But the digital is so much faster and more accurate. It's fascinating. So we take that from the patient. We have now a copy of your mouth in the computer in a matter of hours. I mean, I send it to the computer, it processes about a couple hours, I have it available to me. So for the patient, it takes about 5 minutes. They take the pictures, and I have that in the computer. Then we take a 3D X-ray, which, and the primary goal of that is to know how much volume of bone the patient has to receive the implant in the area where they lost the tooth. So now I have a copy of your mouth with the teeth and the gums. And I have a 3D X-ray that has the copy of your jawbones. What I can do with software, with a computer, is to merge those two files and make them match. It's the same person, so they should match. So they match. Now I have the exact copy of your jaws with bone, gum, and tissue, and gum and tooth. Well, what do I do now? I have a gap, and I want to place an implant there. What I do in the computer is I design a tooth, an artificial tooth that's going to be in the gap, substituting the area that is a gap. So I create the tooth there first. That's the first thing I do. That's called reverse planning, because I want to make sure that tooth is going to bite with the opposing tooth on the other arch perfectly. So see, I didn't place the implant yet. I'm not doing the surgery in the computer yet. I'm going with the end goal in mind. I have the ideal tooth in place. And that is merged with the 3D X-ray and with the copy of your mouth, the iTero. At that point, I'll place an implant that's going to go exactly at the right angle and axis with the tooth, with the artificial tooth. Only now I'm placing the implant. That's the last thing I do.
Okay. Now, you mentioned bone. I know that we have a way now that we can take a person's blood and mix stuff up, and you can actually grow bone.
Yeah.
And have you ever found a patient that was, I don't know a better way to say it, too old that they couldn't grow bone?
No, never.
So
No. As long as if you're alive, let's put it that way. You're not.
Okay.
You're still alive. You're 90, 98. And I'm saying 98 because that's the oldest patient we have with implants in their mouths.
The ones that you've done?
Lee Sheldon. Dr. Lee had one. Mine was 86 here.
Okay.
But we have a patient that comes for cleanings, and She's 98. She has an implant there.
And she had an implant.
Yeah, by Dr. Sheldon. So if you're alive, your blood is giving nutrients to your whole body, to muscles, to organs, to everything. So it should have the same factors, the same power to create bone wherever we ask it to. So we're placing the blood products in an area that needs bone. We just put it there, and there you have the cues for that blood tissue to become bone.
The reason I ask that question, folks, is because they had to do that to me to grow some bone. In fact, Lee did it so well that he grew too much bone, and they had to grind or cut or surgically remove some of the bones so they could put the implant in and have enough room to do all the work that needed to be done. So I know that you can do these things. The sad part about it, Dr. Furtado, is that there's so much that we don't understand, and we think that the cost of dental implants is prohibitive, and I know that everybody can't afford them. It's just like everybody can't afford a Cadillac insurance plan.
Yeah.
But I think more of us need to think about how comfortable we could be if our teeth click together right and our bite is good, because there are so many other problems like if the teeth don't meet correctly, then the TMJ syndrome that's can cause headaches, right?
Yeah, you overstress your muscles.
You overstress the muscles in the jawbone.
And the joint, yeah.
Causes headaches. So there are just so many things that correct alignment of our teeth is so important. And if we have big gaps, then the other teeth can actually protrude into the gap, and they continue to grow. And so there's just so many reasons why we need to go to a periodontist or a dentist that recognizes periodontal disease, and we get people to the right treatment. You've done a lot of talking about saving teeth and everything, but is there some training mechanism or something that's used that periodontists are trained to save teeth, and if necessary place implants that can be predictable, but basically you focus on diagnosis first.
Yeah.
And what is something that, as a periodontist, as we close out the show today, what would you like to tell our listeners that they should do about care of their teeth?
Well, I think the most important thing is to visit your dentist and make sure that you are taken care of according to your needs. And we make an analogy to this that's very important. You're not going to you have a heart problem, you need a heart surgery. You're not going to look for a general physician, a doctor, and do that type of heart surgery. You're not going to go to an orthopedic surgeon to do a heart transplant. The same way, you're not going to go to a cardiologist to operate in your back because you have back issues. It's the same idea with dentistry. We have excellent general dentists out there. But it gets to a point where there is trained people to help you with your needs. So you go to your dentist and you're having problems with your gums that won't resolve. It's probably time to ask about a referral. You have a root canal problem, you have a decay that's too deep into the nerve. It's probably time to ask about a referral to a root canal specialist. So that's, I think, the most important thing. We're getting into a point in time where information's all out there. You look in the internet, and the patients are in command, and they can ask for that. So go for your cleanings. If only with the general dentist, be aware that there are specialists that will be able to help you if your problems are a little deeper than just restorative and cosmetic things. And if you're going to your specialist and your restorative dentist, your hygienist in those offices should be able to tell you that you need to see a specialist. So.
And I'm the worst about following that advice because I'm always constantly in need to go get my teeth cleaned. And my wife does a good job of getting hers done. I don't. And I guess I'm one of the lucky ones. I brush every day. I could do a better job of flossing. I talk about it, and I think it's hard to remember, Dr. Furtado, to do all these things. I think so many times the world in which we live is we just we put so many other things ahead of some of the things we need to do for ourselves. I think we're just beginning to find out now how important care of the mouth is. You got about, I'll give you 25 seconds to say the last word, and I'll close it out.
Well, it's been great to be here. It's been a pleasure. I remember when I came here about 2 years ago.
Yeah.
And Lee put me in the same spot, and I was very nervous, and I didn't know what to say. You're always self-conscious about the fact that your English is your second language. And now I'm here, very excited to be here. And my wife was asking me before I left home, are you nervous? I said, no. I know Joe. I know what we're doing. And this is awesome. I mean, this is perfect.
Thank you, Dr. Furtado. And thank you, listeners, for listening. If you have a question, you can call here. Call Kay at 473-7770. That's 473-7770 if you need to talk to Dr. Furtado. I'll see you next week. Bye-bye.